The basics and how to score PHQ-2 and PHQ-9. In this video, we will cover what are the PHQ-2 and PHQ-9, who and when to screen, why you should screen, where and when to screen with PHQ-2 and PHQ-9, as well as how to score these screening tools and where to learn more information about implementing PHQ-2 and PHQ-9 into your practice. What is it? PHQ-2 stands for Patient Health Questionnaire 2 items, and PHQ-9 is for the 9-item version. They are no-cost screeners that have been well validated across many samples. These tools are available in multiple languages, including English and Spanish. Both PHQ-2 and 9 measure symptoms of depression. Who and when to screen with PHQ-2 and PHQ-9. The American Academy of Pediatrics recommends screening at the 1, 2, 4, and 6-month well-child visits for perinatal depression. Perinatal depression screens can be billed for birthing and non-birthing caregivers about their experience of current depression symptoms. Importantly, if a person's screening results with PHQ-2 indicate depression, a full PHQ-9 should be completed as follow-up. Why should you screen for perinatal depression? Recent estimates show that approximately 50% of pregnant people with depression are not treated. Approximately 19% of Louisiana parents report some form of postpartum depression symptoms. These data highlight the importance of screening and referring for treatment when there are signs and symptoms of depression for any caregiver. Last, Louisiana Medicaid will now reimburse providers $8.14 per screen when using these instruments during the child's first year of life. The CPT code for perinatal depression screening is 96161. Screening for perinatal depression is important for improving the life of not only the caregiver, but also the life of the child and the relationship between the caregiver and the child. Here are some things to consider when implementing perinatal depression screening into your practice. Screening, scoring, and discussions around perinatal depression should always happen in the exam room. Fortunately, scoring is quick and can be done by anyone in the clinic, but particularly nurses and medical assistants. Discussion should always be with the primary healthcare provider and the caregiver of the infant. Because PHQ-2 and 9 are publicly available, it is easily integrated into electronic medical or health records. Depending upon your system, they may already be available as modules or can be added as a list of questions and build in the scoring. How do you go about scoring PHQ-2 and PHQ-9? The PHQ-2 asks responders to report how frequently they have been experiencing the two statements over the last 2 weeks. Item 1 is having little interest or pleasure in doing things. Item 2 is feeling down, depressed, or hopeless. Caregivers then respond by endorsing one of 4 items: not at all, several days, more than half the days, and nearly every day. These responses correspond to scores of 0 for not at all, 1 for several days, 2 for more than half the days, and 3 for nearly every day. To get the score, you add the 2 item scores together for a total score. If a score of 3 or more is indicated, that requires follow-up with the full PHQ-9 and discussion of depression symptoms, social support, and treatment. For PHQ-9, there are 7 additional items with the same scoring guidelines of 0 for not at all, 1 for several days, 2 for more than half the days, and 3 for nearly every day. Importantly, PHQ-9 does include an item that assesses suicidality. It is important to have a policy and plan to follow up for patients endorsing suicidality. Guidelines for PHQ-9 scoring cutoffs indicate that a score of 5 is for mild depression, 10 for moderate depression, 15 for moderately severe, and 20 for severe depression. Here's where you can find more information about Louisiana Developmental Screening Guidelines and implementing screening into your practice. You can check out our videos on understanding the Louisiana Developmental Screening Guidelines, as well as our Using Developmental Screening resource guides with families. We have region-specific guides for family wellness that include information about perinatal depression and other aspects of family wellness. You can also check out the description box for important links such as our perinatal depression training page, which is a part of the Developmental Screening Online Toolkit, Louisiana Medicaid Bulletin on reimbursement for general development, autism, and perinatal depression screening, as well as the American Psychological Association's overview of PHQ-2 and PHQ-9.